on behalf of organizer in the CS5, I would like to welcome to our workshop. I think today until tomorrow. Jakarta, also welcome to Jakarta, Indonesia. Jakarta is the city with worst air standard. Are good for us, especially is sensitive people. This is dangerous for sensitive people. The air standard in Indonesia, in Jakarta especially. Please, if you go out, must wear the masks. Thank you for coming and joining both on the online and on-site our workshop in CS5. Our big theme is convergent space integrated approach to socio-economic justice. This conference and workshop are organized collectively by 19 organizations. Please stand. Yeah, please stand to the representative from AROS. Please stand. From AROS. Yeah. So from IMRC, Nina Mabel, yeah. From APWA, representative from APWA. Please, yeah. Also from Inspire, from MFA, Viego, Infit, BMC, Select, Ethos, F2BM, Team 9, APSD, TF, AMW, YBS, LIB, and KPRI. On the organizer and in 19. Yeah, not only in Southeast Asia, but also in, I think in Asia. Please, silakan tepuk tangan. Yeah. So the economic and social protection problem, the main problem that is still faced by people in ASEAN, starting from access to health, education, healthcare, housing, as well as public services like access to water, electricity, telecommunication, like of internet, also public transportation. Then social security, which is the responsibility by the state, then privatized like of social insurance, such as BPJS for health in Indonesia. Even though the Indonesian government has provided a quota of PBI, PBI's contribution assistance recipient. This is around 96.8 million people. It is still quite far from Indonesian population, around 2,078 million people. Meanwhile, people income and employment opportunities are difficult. The condition of working people are not covered by companies such as informal worker, informal sector, contract and outsourcing workers, also unemployment and victim of layoff. Meanwhile, the arrangement for obtaining PBI for the poor and vulnerable people is not easy in Indonesia. For example, exchange, because before I'm permanent workers, after then dismissal, and to get to the PBI, this is not easy. So it is important for us to discuss the transformative socio-economic and social protection, at least to encourage community sovereignty over basic needs such as food and protection for women, children, people with disability, and other vulnerable or marginalized group. In these 2 days, we will discuss, please join, most of the theme related to socio-economic justice with 8 workshops. In workshop 1, like this one, we will discuss about the maternity such as current problem in Indonesia, where the maternity mortality rate is one of the highest in ASEAN, namely 160 mothers per 100,000 birth rates. Not to mention the problem of stunting and so on, which is also one of the focus of the SDGs. We hope that we can enjoy this IPF conference. We can learn from each other and work together in upholding justice, equality, prosperity for working people in ASEAN. On behalf of the organizer of CS5, we apologize if there are deficiencies from us. And yeah, in the 2 days, in 1st September and until 2nd September, we have a 8 workshop. The first is universal maternity. Yeah, please join. The second is include growth in ASEAN, mainstreaming of social solidarity economy, and improving decent work for informal worker. The third is transboundary investment, borderless impact, and extraterritorial obligation and governance. Yeah. And the fourth, tackling irresponsibility, business practice, and human rights in the textile, clothing, and footwear, supply chain, and the platform economic labor in ASEAN. And workshop 5, beyond bias, building inclusive economies for brighter future. And 6th workshop is revisiting ASEAN guidelines and framework on migration. And the 7th, ASEAN Matter, joint effort in protecting marine and fisheries sustainability through engaging workers. And the last workshop, tomorrow, panel discussion of civic advocacy with the SDGs, voluntary national review, and people scored in Southeast Asia. Thank you to everybody join in the workshop. Please enjoy. And the next, I give the moment to Tuha. Welcome to Tuha. Tuha is the coordinator from AROS, also from IMRC.
Satro, thank you, Robert. So, Satro, take a little bit time to introduce to you all the workshop in our conference space. So, in our conference space, we have 7 workshops Today is the first one, and I hope that you also attend the next 6 workshop tomorrow. So now it's just before we talk about maternity protection, I would like to talk a little bit about something broader about care economy. Some quiz to you. Okay. Question. Cannot hear? Okay. You know, there is a special mind for this workshop. Tomorrow we have a better one. I will raise my voice. Okay? Huh? They can hear or not? Huh? Here they cannot hear me. So I stand in the middle, okay? Okay. So quiz to you. How much of care work in total global work times? How much? 1/3, half, 2/3. How much?
1/3.
1/3? Okay. Half. Half. You see, all the work time of the global working work time, half of that as a care work. Okay. How many percent of unpaid care work that do by women globally? How many percent? 30%, 50%, 80%? 80% global. More? 65 or closer? In fact, that 76% global. And you know how many percent in Asia Pacific? How many? 80. Oh, correct. 80. So high, 80%. And how many percent in ASEAN? We don't know. But I don't think that is below 80, yeah? Because Asia Pacific. Okay, so talking about the care policy. What is the care policy? Care policy is a public policy that allocates resources to recognizing, reducing, and redistributing unpaid care work. So it's very important, right? Very important. Okay. So we can say, for example, care work is can be the policy in terms of money given you, or service, or the time. For example, leave. You heard about leave, right? Parent leave, maternity leave, paternity leave, child care leave, etc. And also about the care services, right? Like a preschool for the young children, for the sick pupil, etc. For the pregnancy, for the childbirth, etc. And social protection, important, right? Social protection is very important. So we need to take care of the people in needs. Like when we talk about the care, we talk later. The big part later today we talk. And another care policy is a family-friendly working arrangement. It means that we need to have sometimes we need to have a part-time work. We need to have a flexible work to take care of our people in our family as well. And the last one is a kind of the policy to provide the infrastructure. For example, to provide the clean water, to provide the hygiene or electricity. That also belong to the care policy. Okay, I will talk a little bit about ASEAN policy. So in ASEAN, when we're talking about care economy, we have several frameworks. One framework, they call the Comprehensive Recovery Framework in 2020, just right after the COVID. Second one is a comprehensive framework for care economy in 2021. And the third one is a gender mainstreaming strategic framework 2022. All in total, what we can see inside, one thing is the gender mainstreaming. It means that all the policy or initiative from the government need to address the need of women and girls, and also need to hear from them, need to reflect their voice. And the second part, important one, is mainstreaming, maintaining, and strengthening essential health services. Increase capacity of public health services. This is very important because, especially after the COVID, all the government recognize that, oh, our public health services have a problem. So we cannot cope. It's a problem. Cannot cope. It's a pandemic. So now they have some decisive effort to improve that. And of course, for us, what we need to do is to force for that goodwill to be true. The third one is a strengthening and broadening social protection and social welfare. So when we talk about social protection and social welfare, it's a care economy, it's a lot of things. Yeah, but also like the government say, oh, we need to have a universal social protection, to broaden the social protection to the informal sector, for example. And for the children, we need to care more for the very young one. So it means that we need preschool for the young children, for example. So all this one is in the ASEAN framework. And what we need to do is we need to push for that, to come into the practice. So next one is so that's why we do this research. AROS do that research because what? Because maternity protection is a very important component in the social protection in general, and also in the care economy as we saw. And we, as a network of the social protection, how to say that? It's a roundtable on ASEAN roundtable on social protection, that we really want to contribute to address the unpaid care work that 80% that women in Asia Pacific take 80% of that. And we want to have evidence for our advocacy, to provide policymakers, to provide ASEAN governments. And so that's why we have a research in both South Asia and Southeast Asia. And in Southeast Asia, we have research in Indonesia, Malaysia, and Thailand, Philippines, and Vietnam. So after this, we have the sharing from the research. So after that, I would like to introduce the online presenter. That is Supriti. Supriti has over 10 years experience in research, policy advocacy, and gender and development issue. So Supriti, are you there? Supriti,
I was mute.
are you there?
I'm here. Thank you.
Okay, so your floor now.
Okay, thank you very much. I'm just going to share my screen and then see. Okay. I think, can somebody help me to share the screen? Not being able to share. Here we go. All right. Okay. Okay. Thank you very much, Tuha, and thank you to all the participants. Hello, I'm coming in from Singapore. I wish I could be there, but unfortunately I couldn't be there in person. So I will have to make do with being with you online. Tuha has already given you the background to why we started this research. And in the next minutes, I will go through a little bit of the main findings from the research so far. Now, in the interest of time, I will not go, since all of you already, I think, have a copy of the slides that I have prepared. I'll not go into very much detail into each of the slides, but very briefly, go through the presentation. So as Tuha mentioned, why did we want to do maternity protection? Because maternity protection is essential to achieving the Sustainable Development Goals. And studies have found that maternity protection helps to create better health outcomes, increases income security, reduces poverty, and in some instances also found to help reduce violence against women. But the next question is, why do we want to study women in the agri-food sector in Asia, Southeast Asia? Well, quite simply, agri-food sector is a major source of employment and livelihoods for women. And to paraphrase the words of the FAO Director General, if we tackle the gender inequalities endemic in agri-food systems, the world will take a leap forward in addressing the goals of ending poverty. So this is why we wanted to do the study on maternity protection. So what is maternity protection? In our research, we have followed the ILO's established 5 core areas of maternity protection: maternity leave, cash and medical benefits, health protection, employment protection and non-discrimination, and breastfeeding arrangements. Since maternity protection is a fundamental human right, the provisions for maternity protection are reflected in several human rights treaties, and I've just reflected a few of them here, and as well in several UN global declarations, such as the Baby Declaration and the Platform for Action. Explicit provisions for maternity protection are outlined in the ILO standards. I've already mentioned the Maternity Protection Convention 183, which provides, for instance, provisions for maternity leave of 14 weeks and breastfeeding facilities. It sort of outlines some of the main aspects of maternity protection. Of particular relevance here for us is the Recommendation 2015 on the transition from the informal to the formal economy, which explicitly recommends that maternity leave will be extended to all workers, including workers in the informal sector. Closer to home, as Tuha has also just mentioned very briefly, there are also several provisions in ASEAN for standards and frameworks relating to maternity protection. And in particular, the Hanoi Declaration on the Enhancement of Welfare and Development of ASEAN specifically and explicitly mentions that we need to improve maternity protection in the workplace. So with this in context, I will now go on to try and kind of pull out some of the major common themes that are coming out from the research. But as you can see from this table, which I've put together of ASEAN at a glance, this is not really an easy task because the countries of ASEAN are very diverse and very varied, whether it's in terms of population levels, economic development, or in terms of levels of progress on gender equality. But with this in mind, we come back to our research and we try to provide, as I said, our overall aim, which is to provide an overall picture of social protection related vulnerabilities of workers, especially of workers, women in the agri-food sector. We looked at several research questions, which really effectively looked at 3 main aspects. What is the status of social protection, particularly maternity protection of women in the agri-food sector? Does the current level of benefits and protection actually meet the needs of women in this sector? And if not, how can these be improved? The emphasis, so how did we do it? We did a combination of secondary and primary research in 2 phases. The first phase mapped out existing data maternity protection policies, and the current stage, which is currently underway, is a combination of secondary and primary research. The secondary research is really mainly looked at desk study reviews, literature review of existing research on this area, as well as existing data sources and data analysis of maternity protection. And the primary research included many organizations across the region, and it used focus group discussions, case studies, and interviews with either women workers directly, as well as other stakeholders such as civil society officials, government officials, and so forth. Throughout the research, in whichever country we did it, the emphasis, however, was in trying to ensure that the women's voices were heard throughout in the research, that it's their needs and the women workers themselves, that their needs and their voices come through in the research. And I hope that in the sharing that some of these voices will come through. The research covered 5 countries, Tuha has already mentioned, and different primary sites across these countries. And in each study, the country teams looked at either a specific sector of the agri-food sector or at specific groups of women within the agri-food sector. Now, before I move on to the findings, key findings, I just wanted to highlight that what my job here was to look at, as I said, the regional comparisons and pulling together the regional themes. And we face some limitations in doing this primarily because there are, differences in data. There's not some standardized data for regional comparisons. National level data tends to be different. The sources that I use tend to be different. Sometimes definitions vary. And as I've also mentioned here, the conceptualization of what constitutes the agri-food sector also tends to vary between countries. So in terms of regional comparisons, there can be it makes it a little bit more difficult. So with this in mind, I took through all the country studies, and what did I find? Okay, the first thing, of course, as many of you already know, the agri-food sector is a very important sector for the economies of Southeast Asia. It contributes a significant proportion of GDP, as well as employment for both men and women. For women in particular in Southeast Asia, it's particularly important because the agri-food sector, according to estimates, actually employs almost half of the total employment of women in Southeast Asia. However, a large proportion of these women are informal sector workers, and they tend to be, and employment in the sector tends to be more marginalized. The women tend to be marginalized with poorer working conditions, either in lower paid, lower skilled jobs, and with less access to resources such as land or financial inclusion, banking loans. In relation to maternity social protection, this makes informal workers quite vulnerable, and particularly why? Why is that? Because in general, social protection of women is generally low in the region for all persons, and not just for women or women in the informal sector. And one of the reasons for this is that public expenditure, government expenditure on social protection is generally quite low, lower than the global as well as the regional average in Asia and Pacific. Now, coming to maternity protection in particular, what we find is none of the countries in ASEAN have actually ratified the ILO Convention 183 on maternity protection. On a positive note, however, despite not ratifying this convention, all the ASEAN countries do have some maternity protection that's anchored in legislation, although the duration of maternity leave and the level of benefits tends to vary by country. The main problem, however, is in terms of the scope of maternity protection. As you can see here, informal workers are usually excluded from large number of maternity leave policies. Why? Well, the first issue really relates to the conditions of eligibility for maternity protection. A lot of the time, the qualifying conditions for being eligible for maternity leave or maternity benefits tends to be tied to either employment, level of employment, the nature of work, or you have to have a contract or a duration of employment. For example, in Thailand, agricultural workers are covered under the labor standards and laws for maternity protection. However, the law stipulates that I think you have to be employed for 180 days continuous prior to your maternity leave, which effectively, and to be eligible for Social Security benefits, which effectively excludes all those who work in seasonal or temporary work. And a large proportion of agricultural work tends to be seasonal. So really, a majority of women are working in seasonal work and are effectively excluded from this law. Similarly, the other problem then is linked to actually, you may be eligible for maternity leave, but only if you contribute to a scheme. So in Thailand, migrant workers, for instance, if they are documented, and there's a distinction between documented workers who are actually legally covered and undocumented workers, they are eligible for some form of Social Security under the Section 33, but they need to make contributions. Both themselves and the employers will have to make monthly contributions, and the level of contribution varies between 1 to 7 months. And as you can see from some of the quotes here, sometimes the employers don't provide the contribution, and sometimes it's actually very difficult for women who are already earning very little to be able to provide these contributions, and therefore they do not have access to the schemes because they didn't contribute. Then the next issue or the next problem is actually related to implementation. So you may have laws in theory, but in practice, implementation is low. First of all, women often don't have information or are not aware about the maternity protection laws. In the focus discussions in Philippines, for instance, it was found that many women said, oh, we don't even know that this extended maternity leave law that was recently enacted covers informal sector workers. And if they'd known about it, they would have tried to avail of the benefits. In Philippines, again, one of the problems that came about was during COVID, the application, and this was because of the issues that came out during COVID, was the application procedure for access to Social Security was digitalized. And as the primary country team in Philippines pointed out, this created even more difficulties for women because they don't always have access to the internet or to mobile phones. In fact, a survey in 2019 found that only 18% of households in Philippines had access to the internet. Given this, they can't even apply for their relevant Social Security if the procedures are digitalized. But even if they are available, because of the way that the sort of nature and the structure of the sector, most workers are either working on a daily basis or they have very low earnings. So they're concerned about the level of earning, and because they need money and their fears about income security, despite provisions that what we find in reality is that most women continue to work right up to childbirth or return to work almost immediately after they give birth. And really the best quote I could see is this: for us farmers, especially women, no work, no pay. And when they have no pay, they have to go back to work. And it becomes as simple as that for a lot of the women. From the employer perspective as well, we find that there's limited monitoring. So a lot of the Social Security schemes also involve contributions from employers, for example, in Thailand. And if employers do not hold up their end of the responsibility for providing social protection, there's very little monitoring of, sort of follow-up and consequences that they usually for these employers. The primary research in Thailand, for instance, found that employers sometimes deduct money from workers' salaries for Social Security, but fail to remit them to the Social Security fund, which then creates barriers for women workers to avail of the Social Security because the contributions are not included. The final problem, the other issue in terms of implementation and actual coverage for maternity protection is related to gender norms. Again, there's this gap between what you see in theory and what you see in practice. So by law, women are protected and there should be no discrimination in relation to pregnancy. What we find from the research and the studies that are coming out is that women still feel worried and they're still scared about being dismissed because of their pregnancy, so they tend to continue working. There have been instances where women have actually resigned from their jobs prior to pregnancy, their childbirth, because of morning sickness or health complications, even though by law they could have been taking leave because of fear of employer consequences. And you also find that sometimes, because a lot of the women are daily laborers, are often hesitant to take up employment because these women are pregnant. And to mention care and unpaid care a little while ago, and this issue still remains unchanged. We mentioned 80% of unpaid care is done by women, and the burden still remains with women, and it's unchanged. And in fact, despite maternity protection, during pregnancy and after childbirth, women still take on the disproportionate share of doing the work in the house and childcare. And that not only limits their employment options, but it also creates issues in relation to health, for it doesn't give women enough time to recover or heal from protection. And I really, the gender norms are such that men do not take up this responsibility. And there's a quote again in the Philippines, which says, oh, men may do during weekends and maybe during their day offs, but they do no earning and very little childcare. So that's, and often the women themselves expect that. So gender norms haven't changed until this unpaid care sort of disproportionate changes doesn't change. Women will continue to face the burden. And linked to that, few countries have actually made much changes. Few countries, I think I had a slide a couple of slides ago, I put this, only a few countries have put in provisions for paternity leave or parental leave. So the norms around sort of care works remain largely about women taking it up. Then in terms of health protection and maternity protection, what we find is, on the positive side, there are several countries that do provide some form of free health protection and free medical care for women during pregnancy and childcare, but it's not always optimal. For instance, in Philippines, the PhilHealth, there was this case study of a woman who was pregnant and she managed to cover a large share of medical during childbirth and the hospital expenses from PhilHealth, which is the healthcare system there in Philippines. However, she still had a lot of out-of-pocket expenses. She still had to pay for the anesthesia, for the ultrasound, and diapers for the baby, which when she did the calculation, comes to a significant amount, I think about 6,000. This is a huge burden for women and still ideal for them. And so often women, even though free healthcare is not always optimal. And then coming to the aspect of once the child is born, breastfeeding and even childcare provisions are quite minimal or almost virtually absent across the region. So Thailand, Malaysia, and Indonesia have no provisions for breastfeeding services for informal sector workers. In Philippines, lactation stations are provided, but if they are provided from the research, it's normally not up to standards. And rules on such as breaks from work for breastfeeding are usually not prescribed. So if you were to ask the question, is maternity protection for women in the agri-food sector adequate? I think the short answer would be no. And while it's generally inadequate at present for majority of workers, what we also found, and we would like to highlight, there's some groups of women who are actually more vulnerable than others. For instance, migrant workers, in particular the undocumented migrant workers who cannot access social security benefits, and because of their lack of legal status, cannot even avail of healthcare services. Then in Malaysia, single mothers face a higher burden, for instance, in terms of healthcare, childcare, and balancing childcare and work responsibilities because of the sort of limited support that they receive. So these groups tend to be more vulnerable than others, and policies would need to make sure that these groups are specifically targeted. And in general as well, while there are specific groups, the other issue that has come up of recent is that the risks that we saw, the sort of inadequacies of currently women are already vulnerable to gaps in social protection, and these risks have been amplified during COVID. Then not only did women lose their jobs and livelihoods, there was difficulty in accessing healthcare during COVID, and there was also increase in costs of healthcare because often due to isolation and social distancing, women faced a higher level of care. And I gave this example of this woman from Thailand who said she delivered a baby during COVID, and she said normally this room would be free, the delivery would be free, but for this baby I had to have a special room to wait for delivery, and it cost 1,500 for the room rate only. So that's costs money, and these therefore increase the risks for women during COVID. So what should we do? Obviously, the general recommendation is we need to make sure that legally as well as effectively, women workers in all sectors are covered. So we need to extend maternity protection to all workers, universal maternity protection covering informal sector workers, migrant workers, to all workers. And likewise, linked to that, correspondingly, we need to provide universal healthcare. But as the research has just shown, it's not sufficient. We need to make sure that the legal provisions actually work in practice. And to do this, we need to improve implementation as well as the monitoring of maternity protection provisions across different countries. Related to this, we need to make sure that data is collected on women workers and maternity protection, because if women aren't counted, they often don't count. Coming to ASEAN then, that means that, ASEAN has already made, as we've discussed earlier in the presentation, and as Tuha has also pointed out, we've already increased commitment, have already got a lot of commitments to universal maternity protection. But one recommendation is we need to increase the protection, to have more guidelines, more frameworks, really strengthen the sort of provisions and how we could go about making maternity protection and healthcare, universal social protection, a reality across the region. One way to do this would be to have, and ASEAN is where the role would come up because it's a regional body and it has regional frameworks, is to be able to provide standardized regional guidelines, whether it's in terms of key concepts. As I mentioned earlier, one of the problems with regional comparisons was in terms of trying to find concepts that are used across the countries, whether it's informal sector workers or agri-food sector or the agri-food sector. We need standardized guidelines on these key concepts. And we also, this was a recommendation related to migrant workers, but it's actually relevant to across for all workers, providing standardized maternity protection guidelines. If ASEAN could assist in developing standardized protection guidelines, each member country could adopt and implement these guidelines, and it would be a unified framework that would be used across the region. specifically in relation to migrant workers, because ASEAN can play again a unique role, because for migrant workers, some of the issues involve multiple countries, because you have the sender, a receiving country, and you have the destination country for migrant workers. So through the regional cooperation, through facilitating the creation of bilateral agreements, ASEAN can play a very role in sort of assisting in sort of providing adequate rights for these workers by sort of establishing some minimum set of standards, by establishing support services, and also in terms of establishing a regional monitoring mechanism. Now, I had put down establishing a regional monitoring mechanism as something specifically for migrant workers, but actually this is also something that ASEAN could do across for all workers, because a regional monitoring and reporting would help ensure accountability for in all countries in general, if we have it for all workers in the region. Likewise, for governments, we need to ensure that governments focus on expanding the scope of maternity protection, whether it's in terms of the sort of workers who are covered to make it universal, whether it's in terms of the duration of maternity leave or benefits. And at the same time, they need to improve on their implementation of these provisions. They need to provide clear communication and accessibility to information, ensuring that all workers are aware and can have access to information on how to get maternity protection and how to avail of the benefits. This would involve, for instance, even providing non-digital means, ensuring that women in remote areas and in rural areas also have access to information. The first step towards doing all this, in expanding the scope and implementation, would be to increase expenditure on social security. I've included here an estimate of, running out of time.
Yeah, it's you burn already the time.
So
Can you in 1 minute?
Yes, I'll just finish it off. Okay. The costs are here, which I will just say that our expanding maternity protection is relatively small as a comparison, but the big. So I will move on. We also need to work together with civil society, and for civil society, they have a role to play. The research came up with several good practices that on community-based programs, which civil society could share and implement and replicate across the region. But a major role for civil society, as you know, would be in terms of enhancing advocacy and strengthening information and awareness campaigns on this issue of maternity protection. So working together, I hope we can work together and we can find and finally have the reality of having an inclusive. Thank you.
Thank you, Sumiti. Okay, big hand to her. Even that she burned 15 minutes more. Sorry.
Sorry, went a little bit over time.
Okay, that's okay. Okay, so now we have 2 panels more. So I hope that you will stay a little bit longer here. Is that okay? Okay or not? Okay. Okay, that's the first panel. After the regional researcher, we will have a representative from country researcher group. They will share with you the specific recommendation toward the government, specific government. But maybe because we don't have enough time now, so if we shorten that part, otherwise, I would like to invite all representatives of the country team to come here. Donna Sita, Director of the Institute of Women Empowerment, feminist working on human rights for more than 20 years. Okay. And Kiha, coordinator of Young Chiu Worker Association with more than 10 years working for migrant and labor rights protection and promotion. Oh, only men. Sorry. We have a Theo Suan online. Theo Suan, can you show your face? Can you show her face, Theo? Theo Suan is the executive officer for research in the All-Party Parliament Group Malaysia, working for localization of SDG. And I would like to invite Dr. Bunsam Namsambon, Secretary General, please come. Foundation for Labor and Employment Promotion. More than 30 years of working with informal worker networkings. Next one, I would like to invite Dr. Nguyễn Thị Lan Hương, Director of the Institutes for Vocational Education and Social Protection. More than 35 years of research and consultation on women and labor movement and social protection. And one more, Josephine Parila, President of HomeNet International. More than 30 years working with home-based worker. Okay, we all view here because we don't have much of time. Oh, what you have in your hand? What is that? Okay, so greeting to all of us. Okay, so in fact that what is that? What is that? What is it's your flag? What is that?
Okay, that is the recommendation. We have like a 4 recommendation, but I want to have a short recommendation because of the time. Okay, just say one. Okay, to encourage special the ratification kilo number 183 is concerning about maternity protection to encourage a special law of regulation regarding maternity protection in Indonesia. So because I know
She's not done yet.
I talk about to ratify the kilos 183 to concerning about maternity protection to encourage special laws or regulation regarding maternity protection. So maybe another recommendation country because we don't have a lot of time.
We do it for Asia or the government?
Your government.
Oh, hi government. Okay, cool. So actually, so this is for the agriculture sector for migrant worker in Thailand. So actually, the reasons why that we don't have, especially for the agricultural workers and migrants worker, the reason why they cannot access the social security schemes is because of their immigration status. The Thai government itself, even though they accept the migrants worker and the laborers, they don't have specific system and the systematic process to actually accept them and actually put them in the social security schemes. They don't even have a document system. So those migrants worker working as most of the workers working in the agriculture sector are undocumented workers. Therefore, they cannot access any health and social protection schemes. So the recommendation is, please, we should start doing with the immigration status. How can we actually do it? And also, we should start thinking about inclusive social security schemes that all of the migrants, not only Burmese, because there are millions of migrants working and living in Thailand and they're undocumented. So they should be having inclusive social security schemes for all the migrants in Thailand. That is a recommendation.
Okay, for me, I think that I'm going to talk about the dream, but we just hope that the dream will come true. Our recommendation is on social protection scheme should be universal.
I think my recommendation almost like other country. For Vietnam, so only now formal sector are eligible to cover by the formal by absolute compulsory social insurance, and only compulsory social insurance provide maternity protection. So that's why the first one that and we have another conditions that they have to have the labor contract with more than 1 month, so that you can eligible for the social compulsory social insurance. So the first of the recommendation that you have to expand the coverage of the social insurance for the all workers like other countries. But in other ways, you have to now. So government have planned to add the more maternity social insurance to the voluntary social insurance. So that one is good, but you have to look at the ability to pay for the voluntary social insurance for the agriculture worker, which is very low. So the government need to continue and increasing the support of the government to pay for the social insurance.
Okay, our demand to our government is, of course, enact maternity cash benefit for women in the informal economy, especially to those who cannot access maternity protection through social security system and other social insurance mechanism. Likewise, we demand for the government for free prenatal, childbirth, postnatal, newborn screening, free medicine, laboratories, and other maternity-related services. Lactation station and the informal workplaces should be in and inclusion in the local health investment development plan, including the lactation management program in all lactation managed by the lactation in all localities managed by the local government units with the civil society participation.
Thank you. Okay, we thank all of them. In fact, that in their hand, they have a lot of the flag, right? That we try to record and send to the country government also. Okay, so thank you all for your contribution. Next, we collect this one. And I would like to introduce the next section. Okay, please help me to that. Sorry. Sorry, Tao. Your turn, not yet. Okay, please talk. Sorry, Tao.
No, it's okay to hello everyone. So my part is informal workers are almost invisible in Malaysia because they are not well documented in Malaysia's statistical department. So I believe that this is one of the reasons why single mothers who are working in the informal sectors are often unheard of, and they are often left out from the social protection and maternity protection in Malaysia. So my recommendation is really for the government to have a proper documentations of these informal workers. Most of them are unregistered, but it's important to document them. At least we know that how many of them are women and how many of them are single mothers, and how many of them are living in the precarious kind of situations, and how many of them really needing the help and what kind of a help that they need. So yeah, that's all from me. Thank you.
Sorry. Okay, so now we have a second panel, shorter than. I would like to introduce Auras Sevilla, the focal person of Southeast Asia, woman in informal employment, globalizing and organizing WIGO, a development worker, feminist, and social protection specialist. All right, your turn.
Thank you. Hi, good afternoon, everyone. Are we still alive? Good afternoon. Okay, so this is a very interesting panel because this is a part that we're gonna hear from you. Okay, we've heard about the results of the study. We've heard about some voices from our researchers about the recommendations, but this is now the opportunity for us to discuss. I like what Dr. Ben said during this session, like we need to discuss more and share, no? So this is what we're gonna do. But before that, we invited two resource panelists here, both from Indonesia and Cambodia, because we have not heard anyone from Cambodia yet, right? So we invited Pauline. Ted Pauline O is a labor right activist from Cambodian Food and Service Workers Federation. So she's the president, okay? And we also invited Ms. Mike Berawati, the Secretary General of the Indonesian Women Coalition for Justice and Democracy, or Indonesian Women Coalition. So let's just try to interview them, no, based on their experience here in Cambodia and Indonesia. Like,
based just on your going on the ground and from the feedback of your members, what do you think is the key challenge for them in accessing maternity protection?
Thank you and hi everyone. I think you all still have energy because run out of time. I just go straight to the point. So my experience, we are talking about short-term contract. It's still effective to our member and especially for the women, they cannot access to maternity leave and also employer can discrimination while they are informed, you know, because NSSF, while the employer already register National Social Security Fund, when the women start to have a pregnant, they need to inform to their employer because the employer need to pay fee to the NSSF. So when they are informed, this is the way of employer can be, you know, they don't want to pay for that because they pay 50% of the salary for the women worker and also they pay the fee, they pay the fee for the NSSF. So how come they want to pay that and they want to be responsible for the women worker? So this is the way of discrimination beyond the short-term contract and also another way to access the maternity leave protection. And another one is about for the, you might heard only mostly specific on government sector. And another one, entertainment worker, it's also very discrimination. You see and notice most of the women in that sector, but you never see the women have a pregnant working in that sector, right? So, you know why? Because the employer always asks the women to take a pregnant test to make sure that the women no pregnant inside their workplace. If they have a pregnant, they have only choice. If they want to have a baby, they need to resign. And if they want to have a job, they need to force abortion to get the job. So this is very hurt, very shocked when we are talking among the women and they share about the experience. And the third, even though we have a good labor law, but no labor inspection. So this is the way of, they have a powerful to play their role. If the employer not compliant to the labor law, they can use power to order them to compliant. If they are not compliant, they can shut down the business. But because of the corruption, it's not easy and also very powerful of the businessmen. You know, they will have a power relation between the high-ranking people. They set up that kind of business, and also they are influenced to the policymaker. So sometimes they can change the law to violate all the workers around the country. Just amendment only one article, then they take all the benefit from the worker of the whole country. And the fourth, we can say that the workers still are limited organizing. That's why even though the labor law and the law is good and the government ratify a lot, but because we don't have voice, we don't have power, they can do everything. I believe that if we are organizing, we have one vision, we have one dream, we can fight them, we can talk to them, we have bargaining power and check and balance with the government. They cannot, you know, do anything, whatever they do. So farmer union very important for the worker. So everyone must be organizing to challenge with the government, even though we have a good policy. Thank you, my point.
Thank you so much, Faline. Yeah. It's very saddening, the situation in Cambodia, like how the capitalist or the employers seems to have more control over the decision whether a woman should have a baby or not. No, it seems like that in the situation in Cambodia. May you also share, like, is this the same in Indonesia, or what do you think is the key contrast of the situation here in Indonesia?
Yes, thank you, Aura. I think we have limited time, so I will explain shortly. But right, from Cambodia the condition is similar in Indonesia. But in Indonesia, I will adding about the condition. Indonesia actually have several social assistance program provide to poor families, and accessible in assessing maternal and child health service, but there are still problems with the data and the target beneficiary, including assistance for female workers who have experienced layoff from their companies. We have find the large data from the pandemic condition last year. The women workers who have laid off does not assessing the maternity protection from their company and the state. And Indonesia have a BPJS Health insurance program, health program national as the provided by the government, but not fully cover the needs of childbirth or other reproductive service. Some services are still paid for in the high. Very expensive, so that not all working women can access it. And not all companies fulfill the obligation to register their workers for the BPJS Health or BPJS employment. The vulnerable things is that most women do not get this access because they are not the main breadwinner of the family. Because in Indonesia, the breadwinner is a man. Yes.
Yes.
So maybe I want to share about how the civil society. Okay.
Yes, so that's really good sharing, no? But let me just quickly ask our audience, do you resonate? I know I'm surprised to see a lot of men in our audience, and I'm really thankful that you are here. Let's clap for our men who are here. I'm just very, very quick questions. Do you think that these experiences are resonate in your own country? Like what they are sharing? Do you think that maternity protection is number one, important, but then many women in ASEAN still cannot access this? Can we raise our hand for everyone who thinks this is a very important, but yet not attended very well? You think in your country, maternity protection is not yet accessible for many women? Do we all agree in this room? Okay, so that's a very important thing that we need to work on. No, so we've heard a lot of recommendations from Supriti and also from our researchers that have done the study. But I also would like to ask the both of you here and later our audience, if what do you also think the government can do? For example, in Cambodia, what do you think the government can do in this case?
Yeah, we can understand that the capitalists, they always find a way how to exploit us. So we must have the idea, and first recommendation to the government is about the short-term contract we cannot finish, even though we talk many years. I still remember I worked in the union movement almost 20 years. And until now, it's still happening with our new generation. So the government should be create or set up the policy on unemployment benefit. Why I say that? Because when the employer dismiss them by discrimination during the pregnancy, so they can take leave at home. They can get the benefit from the state, and they don't care, because this is this business, and they can take care of the kid without worrying about back to work. So unemployment policy, it doesn't mean that the capitalists always say, oh, if we are set up that policy, people might be lazy. Oh, come on, guy. It's already almost 100 years. Some country, they already set up. So it's not the new thing in our ASEAN, in Cambodia or in other country, our friend. So unemployment policy very important to make the employer accountable and bring the people in the labor market. And then we pay tax, right? And the second is about legal inspector. they have a powerful, as I mentioned earlier, so they keep using their role, even though they are corruption, but workers must be have another side. We are organize, and fight with them. We are not depend on them. So our power can change the world, can shake the world. So another thing is about childcare center or childcare community. Is also for informal worker and formal worker, because I see when I drive the motor all the time, the people on the street vendor, they are bring their kid under the sun, very hot, because they don't have the childcare center for them. So they bring the kid along the way with them. They could not access to school. So the childcare center make the people very comfortable, and they can go out to find money to support their family. And also they are, when the kid they are grow up very, smart and healthy to support another economic with the new generation. Thank you from my point.
Yes. So these are really interesting perspective, no, that they can, what are the recommendations to the government? But I'm quite interested as well, like, what do you think can civil society can do as well to address the access to maternity protection? So Ms. Mike?
Yes, thank you, Aura. In Indonesia experience, we making the civil society much more working about the making organized community education for women workers and women in community about how to awareness the maternity right and how to access the maternity protection. Because based on our Inspire number survey, we found that the large number of women labor or women in community does not have quite understand about the social protection and how to access the maternity rights. So civil society and based or the organization WRO, women-based organization must make strength organize the community women, specifically women labor or women workers and women informal workers to have understanding strong about their rights about the maternity right and how to access, and help them to access the BPJS or the BPJS employment. And so civil society have closely advocacy for to government from the national until the local government to have ensuring the policy about the social protection. In Indonesia, bill of the social protection has been in the long list regulation national legislation. So we must strong advocacy to the parliament to have commitment to formulating the bill of the social protection for to be universally and effectively implement in Indonesia, including the maternity protection.
Thank you so much. Thank you so much, Ms. Mike, for also highlighting that we can also provide solution, okay? That civil society can also provide solution to these gaps. And I know in some countries, there are also many organizations, particularly of membership-based organization of informal workers, are addressing this one. For example, when we went to one of the areas of home-based workers, they have their own child-minding activity. So these civil society are very important also in addressing these gaps, like what you can also do, like social solidarity economy, and also like different programs as well that you can also develop in your own organization. So thank you for the two of you. You can stay here while we also, or you can take your seat while we also open the floor now to plenary discussion. So I'm going back again to every one of you. So first and foremost, I would like to ask who among here have kids or kid? Who has kid? Who has children? Children, like their own children. Who? I mean, I bet before you got grandchildren, you get first children, okay? But has everyone here have children? Have children, or maybe have plans to get children? Okay, so yeah, okay, there are some. Okay, so in one way, this is like a common for us, no? One question we would like to ask you is that what do you think also you would like to add in the recommendations? What do you think the government or the state can also do to address the maternity, the access to maternity protection? Is anyone would like to add from, or you have new ideas? Any volunteer? Maybe one thing I would like to ask, I would like to hear from the gentleman. Like what do you think? Maybe we can have, yes, we can hear from our gentleman here. Sorry, we need some for our online audience. Thank you so much.
Thank you. So it's really a question. You know, one of the issues about documentation of illegal migrants from Mexico into Texas and so on. Many migrants don't want to be documented because then they get deported. So it seems to me that one of the issues might be to have a separation between, your rights under maternity versus the liabilities you would get about just being deported or your children taken off you or something like that. So it's a kind of limit on the state, not just the documentation part, I guess. And more people would come forward then.
Yes, Lennon.
Okay, sorry. Okay, sorry. My name is Lennon Wong. I'm from, maybe I go to the front so you don't need to turn your head. So I'm Lennon Wong from Serve the People Association. As a labor organization in Taiwan. We have shelters for migrant workers from Indonesia, Philippines, and Vietnam. I have been waiting for the chance to speak. So, okay. So the maternity rights is one of our key issues in Taiwan. So even I'm not from an ASEAN country, but we have so many migrant workers from ASEAN countries, including Indonesia. And actually, the biggest in number of the domestic workers are Indonesians. And also the fishermen, also Indonesian. But of course, there's no women fishermen. So we don't need to talk about the fishermen now. But both either both in the factory and in the home environment, most of the women migrant workers, they don't have the full protection of maternity rights. Most of them, if they legally speaking, they have the same protection. But if they are pregnant, they might be fired and sent home, or they might be persuaded to resign and go home. Very few of them can really give birth and stay in Taiwan to work. On the other hand is the child care. Even they are lucky enough to give birth to the baby, either still under the employment or through the help of NGOs like us. It's still very hard for them to work when they are, to feed their baby when they're working. Both in the factory or in the house environment. So most of them, they have very, very difficult situation for the childcare. I can say that almost no factories will allow their workers to keep the babies in a dormitory. And for the house employers, also very few employers will allow that because, there's a difference in the domestic workers in Taiwan. Most of them, they are caretakers. They are legally, they are not domestic helpers. They're not servants. There's someone who need the care to be taken care. So the employers will think, I hire you to take care of my dad, my grandma, and now you are the one to be taken care of, and you have to take care of your baby. How can we do? So most of them, they will just throw the problem to the broker, and the broker, the most things that the broker will do is to throw them away. So, okay, well, my last part is what can the government can do? I think that there are so many things the government should do and must do. Some of our former speakers already mentioned there should be a compatible, at least we should demand to initiate the dialogues between the governments for a meaningful, compatible social protection plans. And maternity is part of it. It's a very important part of it. But not only that, it should include also the labor protection, labor insurance, and also pension. So, for example, if a caretaker from Taiwan, she's fired and she go back to Indonesia, there's no benefits for her at all. That's so unfair. And so this is an initial point, and also the child care. And actually the ignorance of the child care already violate several relevant important UN conventions for the rights and benefits of the babies and children. So I think I just take the chance to speak out. And there are so many problems in Taiwan too. So I am totally with you. Thank you very much.
Thank you so much. Thank you so much for highlighting the issues of portability of social protection. So that's very important issues as well. And that's a good recommendation. So just very quick.
Yeah, mine is very quick. Mine is more on best practices actually. So maybe in the research, you might have found some best. I'm from Malaysia actually. Okay. You may have found some best practices that the poor might have adopted in terms of childcare, in terms of maternity and so on. Maybe those examples you can add in your research recommendation. And then best for Malaysia, I can give two actually best practices where we have projects with these vulnerable women who are actually partially single mothers and those who are working in informal sector. So we run empowerment projects with them. The project comes together with the childcare, which means whenever they come for the classes, they bring their children, and we make sure our solution partners, those who are running the program, providing a space for the children to actually play around and all. So that's number one, good practice. And then number two is we're actually developing local learning centers actually. So we make sure the women doesn't travel long for them to attend all these trainings and so on to empower them. So we make sure there's a local center, like it's a physical center, of course, it requires fund and all, but we try to develop some local centers where women is very near to women for them to attend. And it in the long run, it may become a childcare center as well. Let's say the woman wanted to go work and all, they can send their children there and so on. And it actually releases the burden that women normally carries. Yeah. Okay, that's all.
Yeah, actually, I'm going to ask as well, like any good practices that you have, which is thank you for that inputs. I just would like to acknowledge just last two, Dr. Eri and Ma'am. So let's just have here, and next is Dr. Ellie. Thank you.
I'm Bina, and I speak on behalf of migrants here who are normally left out from. Sorry, my name is Bina. I'm from Family Frontiers, Malaysia, and I'm here to speak about including migrant workers, domestic workers for maternity health. Very often they're just sent back. They don't have body autonomy over themselves. And it's very, very unfair because we are in the childbearing age for a small period of time. And therefore, I'm a migrant myself in Malaysia. And so for governments to include maternity care for migrant workers, they are paying levy, they are contributing to the country. So why not also pay for their maternal health?
Yes, thank you. Thank you so much. That's a very important as well. And Dr. Eri?
Okay, thank you. I listen carefully. This is very good research, comprehensive, and as well the recommendations. I want to add something that for the recommendations, I see that you give recommendations for the two parties, government and CSO, and I would like to add with the private sector. Yeah, I have just involved in the Inclusive Business Summit. Actually, that the ASEAN has a policy framework for the inclusive business that mostly targeted for middle up companies. So that means besides the social protection should be held by all stakeholders, including the private sector, which could be the social protection, could be triggered or demanded from the market, yeah. And this is in the Oxfam side event, it is true. We have seen that some of the shrimp companies, big companies, has involving I want to say has following some certifications who demanding the human rights issues in the industries, human rights issues including the maternity and child care for their women and the labor. So I think that is should be included, that not only government and social society, that is good, but including the private sector. Thank you.
Thank you. That's a very, very important point as well. Just last point here, and then we will close the session.
Okay, thank you. I'm Hero from ASEC. I think I don't need to long speech, but we talk about woman. But we forgot we have a partner or husband or anything. So maybe fraternity will be included in this case. Thank you.
Thank you. Yes, that's very important too. Like what Tuha mentioned about recognition and distribution of care work. Let me just summarize and then I will pass on to Suntari to close the session. I think what we have found out or what we have learned from this session is that the importance of data. Many women are missing in the data, especially the intersectionality. So I think it's very important that we include women and the specific status, whether single mom, domestic workers, the type of employment that they do. Secondly is that maternity protection is important not only for the welfare of the kids, but to make sure that women do not fear of losing job because simply they are pregnant or they're having maternity leave. It's very important that we put that this is a very important labor rights. Maternity protection is both a worker and a human rights. Third is that we've seen from the sharing how women in the informal economy are the missing middle in the social protection, particularly the maternity protection. Like they cannot access social assistance because they are not considered poor enough, but they cannot also access contributory system because they cannot provide like regular contribution to the system. And lastly, that I would like to also highlight, there's movement between labor, formal and informal. And that means that I think it's very important that in organizing that both workers from the formal economy and informal economy should work together in also advocating for maternity protection because the both benefits will benefit from this. And just the last point is that how we can also have the role of men or redistribute the responsibility and also on care work, not just to women, but also across, also with men. So thank you so much for also your participation. You can also still leave to us any recommendations you have so that we can input that to our workshop document. Thank you again. So let me just introduce Suntari, the Executive Director of HomeNet Southeast Asia, just for the closing remarks.
Thank you so much. Yes.
Yeah.
Thank you.
I would like to use 3 minutes to conclude our workshop today. The things that we learned together this afternoon, first is we agree together that the mainly commitment of the global economy came from women because we are 80% of our workers of this world. Second is when we talk about maternity protection, it's not about asking for the kindness of government, but we are claiming our right. It's a right of women, reproductive right of women, and also it's a fundamental right of women workers. We are claiming our right, not asking for the kindness of the government. And when we talk about the what kind of maternity protection that we would like to see, people talk about the maternity health care service for both mother and children, and that have to be the good quality service, no? Second is people talk about the security income, or we can say that living income during the period that the women workers have to do breastfeedings for their children. And the third one, some people talking about child care, daycare, no? During the, how to call it, childhood, no? During the childhood to free mother to work, no? And we talking about universal. We would like to see the extending of maternity protection to all kind of women workers in the formal economy, in informal economy, and also migrant women worker as well. Second, we talk about the, some people talk about the affordable. Nah? Sometimes maternity protection in some country is not free of charge. We have to pay the contribution fee, but we call for the contribution fee that reasonable and affordable for all kinds of workers. And the third is about the, it's all to cover essential needs of motherhood as well, no? So all of these things that we learn together as our solution and recommendation will bring to be a part of ACSC APF 2030 statement. And we very strongly recommend that ASEAN and the country members, I mean the country, the state member of ASEAN have to play their active role to implement and improve the maternity protection in our region. Yes. And that is all that I would like to conclude about the workshop of us today. And would like to invite you tomorrow. We will have more seven workshops under this conversion number 5. Nah? The first workshop tomorrow will be about SSE and decent work, and we will have the workshop on migrant worker right, on the worker in the fishing sector, no? Even about the platform workers, and also the living wage, and about clean clothes campaign. So very interesting workshop will go on tomorrow. 7 workshops together at this room. So we would like to invite all of you to join us again tomorrow. And before you go back home, please come to visit this state. Some interesting paper is here. You can read it before go to bed tonight, and come to discuss together again tomorrow.
Thank all of us